your work at Americans for Free Choice in Medicine?
Our objective at AFCAM, the short name for the organization, is to help patients and physicians articulate and take a stand on the moral and political principles which must undergird any conversation of healthcare policy. Those principles are normally totally ignored in the debate. The debate assumes that there is no context, that we don't have a constitution, that we don't have a Bill of Rights, that we don't have a concept of individual rights. What we try to do is show how and why no health care is valid at all unless it's rooted in those individual rights and in the right moral foundation. Physicians are normally treated as the property of government, as if they were natural resources. The last people that the government talks to when it formulates healthcare policy is the physicians. They intend to derive them by some mystical process and then impose them on the system, on patients and physicians alike. Well, now when you go to your doctor, someone else is in the room. The government is in the room. The doctor must now maintain computer records, which most of them were doing anyway. But now they have to turn those computer records over to the government. The government wants them, why? To protect your privacy. They want all your records so they can make them available only to 2 or 3 million healthcare people to look at. But mainly they want them to be able to review and police your healthcare to determine what treatment you are getting from the doctor and whether that treatment is permissible or efficacious or at the right price. There's no legitimate basis. Many politicians want a spoils system, not a healthcare system. And what they structure is a system that allows them to reward their friends and punish their enemies. And actual delivery of health care is a secondary consideration. Well, the maxim is silence implies consent. So whatever we do, whether we think we have a realistic shot at protecting ourselves or not, the case must be made, both morally and for political reasons. One of the main things we do is write opinion pieces for newspapers on specific healthcare issues. And in the last 8 years, we've had about 55 of those published in various newspapers and also widely in websites around the country, websites such as Capitalism Magazine and others that pick those up. Another more unique activity is a systematic response through letters to the editor of healthcare editorials and opinion pieces running in the major newspapers around the country. Those are short pieces, but I always write them on the day something runs in a paper and gets it to the paper, and I get it to the paper by 9 o'clock in the morning on that day, and it's very specifically focused on that newspaper's contents. Because of that, I think, about 10% of them get published. So I can get about 50 letters published a year if I write 500. Yeah, the website has got really almost all of our editorial content. It's got about 60 opinion pieces on it. It's got our major longer pieces on general policy for healthcare. It's got interviews with innovative organizations that have alternatives to not just government, but alternatives to insurance for people that want it. It's got our legal briefs that we file in federal court about healthcare legislation that we don't want to remain unchallenged. And everything on that website is downloadable if people want to print it, or email a link to that content to people they think would be interested in it. And they may also look to see how they can sign up for and support AFCAM.